Do you have another caller on hold? We're going to go back to the phone lines. This time Rose is waiting for us. Hi, Rose.
Hi. I plan to live about 30 more years, and I'm not sure what shape all the other organs in my body are going to be in, but I think my skin will be very valuable, and I wonder if the doctor will comment on the state of using other people's skin, how that's going to, does he think that's going to be a much more, where are we at with that? And in 30 years, where does he think that will be? Because I think right now that is the problem, is that people have to use their own skin.
Thanks for your call, Rose.
Well, as co-director of the burn unit, I can tell you donor skin is incredibly valuable to us. It saved many lives. So the donor program in general is where you can donate your skin and whatever other organs are usable at the time of your death. But there's things like the lens of your eyes and cartilage and bone that are also harvested to meet other medical needs. So just when you get your license, just check off, I want to be an organ donor. Where we sit with what's called homograft or allograft, which is cadaver skin, is our limits are the number of donors, and there's never enough. We only have a fixed number of people donating their organs, and therefore only a fixed number of folks get the benefits. Kind of on the edge, we've had cultured cells in burn care for years. They're very expensive and they're very fragile, and it takes a very sick, highly burned patient to want to go that route, and we have someone in the burn unit that way right now. But that technology is far from flawless, and it's just a stopgap. Genetic engineering of skin is, a lot of people are trying to do that. Using other animals' skin is something we commonly do, and trying to get that as a more commonplace and not have it rejected is also part of what people are trying to do, at least experimentally.
And that's something that's so easy to do in regards to just making that check on your license and letting your family members know that that is your intention to be an organ donor or a skin donor or anything as needed.
Correct. There's no greater gift, as they say, than the gift of life and through organ donation.
In regards to the procedure we're discussing, are there some things that you'd like to add that we haven't touched upon in regards to body contouring?
I think, as you hear me say before, I think a realistic patient is a happy patient. I mean, there's a lot we can do, and the earlier in the process you explore what those options are and you sort of gear yourself towards that, I think the better patient you'll be in the end. There's a lot of folks who get frustrated with the process. You know, they may apply to their insurance company and get rejected, and they just sort of say, well, I'll live this way. But I've seen patients be highly persistent, get on the phone, sort of bug them, go to medical review after medical review, and it may be 12 months, it may be 18 months, but if they're persistent, they get it approved. And like a lot of things in healthcare, you have to be your own advocate. As much as you want to count on your doctor and count on the nurses and count on your insurance agent and everything else, the bottom line is nobody will care more about it than you do. And no matter how caring your doctor is, there's so many folks that most doctors take care of that there isn't enough time to stay on the phone and to kind of work the system. So you have to make it work for you, and the more questions you can answer, the more educated you can be on your disease process, whether it be the obesity or diabetes or the heart disease. I think the more successful your care will be, whether we're talking about body contouring after massive weight loss, or we're talking about someone just with heart block or stomach problems. I mean, it goes across the board.
A lot of people, I think, are intimidated by large insurance companies and intimidated by the process, and they say to themselves, okay, I really want this and I really want to pursue this, but I don't know how to be my own best advocate. I don't know how to be aggressive to go about seeking the insurance approval to get this done. Is there any place to go to inform yourself on really how to do this right?
I have no doubt you can probably Google search how to negotiate with an insurance company if you type those words in. We like to help folks to the degree that we can. We have people in the office set up to contact the insurance company, go through the pre-D. We have copies of most of the major insurance companies' policies of what their criteria are. I never advocate anybody not being honest if they've met those or not. But there's a lot of folks that may not realize what these limits are or what they have to prove as a medical. Because after all, what we're talking about today, kind of been compared to what we talked about at our last visit, it's on a continuum with itself. On one end of that is purely cosmetic, then at some point you cross over to this gray area, and then you go to what's purely reconstructive. it's usually those folks in the middle that sort of, which is this? And we can kind of help sort that out. And like I said, communicating with your family doctor, understanding your policy, understanding what they will and will not cover. I mean, there's some that come outright and say we will not cover bariatrics or the effects of bariatric surgery. And you know what? There's no arguing that's going to change that. There's a lot of people that have kind of company-directed health care where their company sets up the criteria. And arguing with the insurance company is not going to do any good. They've got to go to their human resource person and try and plead their case. So you sort of have to understand where your health care is coming from to start with, at least financially, who's paying for it, and then understand what their rules of the game are. And it is a game.
I want to thank you so much for being with us this evening. We're out of time.